Hi there, this is Dr. Glenn Vanass with another edition of Lasing is Amazing with the I+. Today's topic is the removal of a broken fractured Emax crown. I've written articles about the use of the erbium laser wavelengths with anterior veneers, but it's not often seen in the use of posterior crowns such as in this case. It's a fractured second molar. It's an Emax crown, as you can see here. I wanted to get the other bonded portion off.
6 watts.
You can see we're using 6 watts and 30 hertz, 200 millijoules, 90% water and 80% air, MZ8 tip and H mode. You can see here the tip is used for about a minute to a minute and a half over the top of the remaining bonded restoration, and we're able to leave the tip slightly out of contact, just either barely touching or just slightly out of contact, slowly moving over the surface of the crown in order to loosen the silane bond. After using it, we then take over a Corona Flex, which is made by Cable. It's like a little instrument that will pop the crown off. You can see we're going to put it on the fractured portion here. Put our finger over top of the compressed air, and with one simple pop, off comes the crown. Now we're able to restore this tooth with a zirconia, full contour zirconia crown, and this time it won't break. Here's the one half and the inside, the integular surface of the crown, and the opposing surface that can be sent to the lab for shade. Now we're going to use an MZ5 tip for laser crown troughing. We're using 2.5 watts, 50 hertz with an MZ5, 60% water, 40% air, and S mode. We're able to put the tip just slightly into the sulcus, and with very slow back and forth movements create a little moat or trough around the margin of the tooth to allow for VPS material, vinyl polysiloxane, to slide into the sulcus to give us an impression. One of the beautiful things with the I+ and the erbium chromium wavelength is the lack of bleeding when working with soft tissue. We're able to gently remove the sulcular epithelium and be able to create a nice little moat for our impression material. Care must be taken to not nick the margins, as the erbium wavelength is not selected for soft tissue only. You can see the occlusal view here. We've created a nice surface for taking the impression. We then use our VPS impression material, squirt it over top of the tooth. We're able to get a very nice impression for the crown and not require any use of cord. Here's the impression of the crown in VPS, and here's a provisional in place. So thanks for watching again, and thanks to BioLase, and look out for next edition of Lasing is Amazing with Dr. Glenn Vanass.